To health news now. Well, health experts have warned that the Ebola virus could spread across West Africa in one of the most challenging outbreaks of the disease the international community has ever witnessed. Scores of deaths in Guinea and Liberia have been linked to the current outbreak of Ebola, which began in January. That's according to Tariq Jasarevic, a spokesperson for the World Health Organization, WHO. In Nigeria, health officials say 7 reference disease centers are being upgraded nationwide to check a possible outbreak of the disease.
More than 100 people are said to have died from Ebola virus in the West African countries of Guinea and Liberia, according to the World Health Organization. The organization describes the West Africa Ebola outbreak as one of the most challenging incidents the world has ever seen. So far, Guinea has counted close to 160 suspected cases of Ebola, with more than 100 deaths from the disease. In neighboring Liberia, there have been 10 fatalities so far, with 21 other infections linked to the disease. But what is the situation in Nigeria? The project consultant and epidemiologist at the Nigeria Center for Disease Control says even though the disease does not exist in the country at the moment, 7 reference centers are being upgraded to handle any eventuality.
We always say prevention is better than cure. For Ebola, there is no drug, there is no treatment, and there is no vaccine against Ebola. So the mainstay of keeping yourself off this virus is to prevent any practice that exposes you to Ebola. First and foremost, people should desist from eating bats.
According to the Minister of State for Health, what most Nigerians mistake for Ebola is actually dengue fever, which is transmitted by mosquitoes.
We want to state it categorically, as far as we are concerned, this is limited to Guinea Republic only, and the neighboring countries of Liberia and Sierra Leone.
Just as international aid organizations are trying to stop the disease from spreading further, the Nigeria Medical Association and the project consultant at the Nigeria Center for Disease Control speak about the symptoms and what Nigerians should do to prevent its spread.
Signs and symptoms of Ebola are like any other systemic disease. Malaria, for instance, will give us headache, fever, sore throat, body aches, abdominal aches, cough, catarrh, and so on.
You remember how we contract different illnesses. It's not just Ebola, Lassa fever, cholera, dengue, some form of hepatitis. Always keep your food clean.
Ebola disease was named after a river in the Democratic Republic of Congo, where it was discovered in 1976. But the Minister of Health reaffirms the commitment of the government to tackle the disease if it finds its way into the country.
We have people this time who will be able to ask necessary questions and be able to take steps to ensure that at least we protect ourselves. If in the event we still have people evading all our control measures at all our ports of entry and they're able to come in and begin to spread not only Lassa but even the more deadly ones like Ebola, we should have the ability to know where to take these patients.
The Ebola virus is spread through the exchange of blood or other bodily fluids, and initial symptoms are similar to those of flu and malaria. Between 2 and 21 days after becoming infected, patients experience weakness and headaches, muscle aches and chills. Infected persons die of severe internal bleeding, so prevention remains the best cure for the disease at the moment.